In this presentation, we're going to present the outcomes of a project to look at developing practical approaches to strengthening inclusion of people with disabilities in WASH programmes. It was for Norwegian Church Aid and carried out by Oxfam Consults. My name's Brian Reed. The data collection procedure was quite straightforward. We carried out a literature review to find out what the current state of the art is, looking at key documents and understanding the recommended indicators for this topic. We developed a series of guide questions for a semi-structured interview and then carried out 10 key informant interviews with representatives of Norwegian Church Aid working in various humanitarian contexts around the world. So what did we find? Well, most of the actions were at community level. So we had community focus groups, community facilities, and they were allowing some level of accessibility. What wasn't so good is the individuals who couldn't reach that might have barriers getting there. Perhaps they needed assistive devices, or there were other barriers that were outside the WASH sector. What was good is some of those people were being referred for a bespoke action where the WASH people would go and look at their particular needs. But what we did find that there wasn't really a clear coordination mechanism of who do you go to actually refer individuals for additional support? So that coordination thing with other sectors did seem to be missing. Other things we found out was that there were very few examples of people with non-food items specifically for this target audience, extra soap or extra laundry facilities. So that's a very easy area to remedy. We found there was a low awareness of additional advice and design guidance. And also monitoring and evaluation was difficult, partly because we haven't got a homogenous group. The needs of a blind person aren't the same as those with learning difficulties. So actually having clear indicators, again, was seen as a weakness. Another issue we were asked to look at was how did WASH activity with people with disabilities compare with other vulnerable groups? And we found that actually there seem to be three levels. There's a lot of attention paid to do with issues to do with gender, gender-based violence, women's needs, menstrual hygiene management, and that's being done relatively well. I say relatively. People with disabilities, there was an awareness, there was some action, but actually when we talked about issues to do with people with incontinence or baby wash, that was very much off the agenda. So you could see there were different levels of activity with these different vulnerable groups. So looking to the future, there are two approaches to providing facilities for people with disabilities. One is the universal approach, which is you have a standard design that is accessible to as many people as possible, but not everybody can use it. We could use the inclusive design approach, which is much more bespoke. We look at the needs of individuals, but that's much slower and not really suitable for the acute stages. It will mean there's a delay in getting facilities to people. So we're proposing a mixed approach where we start off with the standard universal design that we can roll out quickly, and then once we've managed to get something for as many people as we can then go back and using referrals actually provide those facilities for people who could get left behind. Another approach we developed was to look at a hierarchy of needs with things like defecation that only the individual can do being our top priority, and then personal hygiene, washing themselves, and then going down through water supply, drainage, solid waste management and vector control. And as you go down this thing, you move from the individual through the household to the neighbourhood. So we give some idea of priorities of the things that we need to address to begin with. We did have lots of other findings, but actually that will have to be saved for another time. Any questions, comments, queries? We'd love to hear from you.